Good morning, everyone, and welcome to the webinar Innovation in Lung Cancer Screening, organized by Center for Innovation in Medicine, InnoMed. Today, in partnership with MSD and BMS, I'm Marius Geantă, the founder of the Center for Innovation in Medicine. I'm very happy to be here today to discuss about this very important and innovative topic, the lung cancer screening, in the light of the Council recommendations back in 2022. The Council for the first time recommended the screening for lung cancer, and in the context of many international European initiatives in the field of lung cancer, the idea of this webinar is to understand where are we now in this topic of lung cancer screening, what can be better done in different parts of Europe. In particular, our interest is in Eastern Europe and Romania. I'm pleased to be today with a great lineup of speakers. And I would like to start this webinar by inviting each of you to introduce yourself and to say a few words about the lung cancer screening, the innovation around this, and what is your perspective. And I would like to start with the patient perspective. Antonella Cardone, the CEO of Cancer Patients Europe, is with us today. So I'll give you first the floor to you, Antonella.
So good morning, everyone, and thank you, Marius, for inviting me here today. I am Antonella Cardone, and I'm the CEO of Cancer Patients Europe. We are a pan-European all-cancer type patient association with a mission to represent and empower the voices of cancer patients, caregivers, and cancer survivors through research, policy, and advocacy. And we currently have 56 members from 26 countries. And when it comes to lung cancer Europe, LUCE, is among our members and is represented on our board. I would also like to start reminding that about 225,000 people died from lung cancer in 2021. And lung cancer is by far the leading cause of cancer death among men, responsible for almost a quarter of death. So 23% of cancer deaths are due to lung cancer. And early detection can be a game changer, dramatically increasing survival rates and improving quality of life. In fact, 65% of lung cancer patients will survive for 5 years or more if diagnosed at stage 1, compared to 5% when diagnosed in stage 4. So these figures are enough to justify why lung cancer screening is a so critical topic and so relevant for us. So lung cancer screening has seen significant progress across Europe in recent years, as public health organizations and research institutions have increasingly recognized the importance of early detection for improving survival rates and quality of life. So we've seen key developments in the new screening guidelines from ESMO and ERS, the European Respiratory Society. Then we can also definitely say that lung cancer screening in Europe is moving forward, also thanks to the EU policy momentum around the EU cancer recommendations on screening, Europe's Beating Cancer Plan, and the Cancer Mission. Lung cancer screening is also moving forward with increased evidence supporting its efficacy, especially for high-risk populations such as heavy tobacco smokers. And also countries like the Netherlands, UK, and France are leading the way with national programs, while other countries such as Italy, for instance, are piloting screening initiatives. So continued progress depends on political will in member states, on refining screening protocols, integrating new technologies like artificial intelligence and biomarkers, ensuring equitable access, and addressing the cost effectiveness of these programs. So ultimately, widespread and systematic lung cancer screening could play a critical role in reducing mortality and improving early detection and outcomes across Europe. Let's not forget the figures that I mentioned at the beginning: 65% survival rate after 5 years versus 5% if the diagnosis is done too late. So thank you, Marius.
Thank you, Antonella, and thank you for putting forward from the beginning the numbers. It's so relevant, and especially I mentioned our focus on Eastern Europe, on Romania in particular, where the diagnosis rate is very high actually in late stages for lung cancer, and we consider that moving forward with the lung cancer screening, this will have the potential to change not just the numbers, but the lives of the cancer patients and the families. So thank you once again, Antonella. We'll come back to you. And now I would like to invite you, Richard Price. Richard is the head of policy at European Cancer Organization. So Richard, what is your perspective on this?
Well, thank you very much, Marius, and good morning all. I'm Richard Price. I'm the head of policy at the European Cancer Organization, and we're an umbrella federation of 41 primarily healthcare professional organizations working in cancer care. And our mission is around improving patient outcomes through multidisciplinarity. And we do that through bringing about consensus where we can on policy opportunities in cancer, then advocating to the EU or to WHO or to national governments about how we can progress that, and then doing projects as well that help to bring that to life. And lung cancer screening very much fits into that model, where we've been developing the consensus amongst our community around how to take that forward, and also being very engaged in some hands-on projects now funded by the EU to help support lung cancer screening be achieved. Marius, you asked for some reflections maybe on lung cancer screening and where we are at the moment. And I was thinking it's sort of the end of the year, that time when we can be reflective. And I was thinking where we were 5 years ago, 2019, when we had a nice Christmas present from the European Commission. There was a promise that there would be a European cancer plan. But at the time, it was a mystery as to what would be in it. How big was this plan going to be? What topics would it cover? Would it be piecemeal? Would it be comprehensive? And the Commission spent a year, wisely, I think, consulting, listening to the cancer community. And we did as well in terms of consulting our community. And some things really jumped out as being very necessary for any plan. Number one, that it should have ambitious goals, but something that was clearly in need of attention was some quite outdated EU recommendations on cancer screening dating back to 2003. So 20 years on, so much had changed in terms of scientific discovery and practice. So those were amongst the key things that we were asking for. And when the plan was published in February 2021, we were very pleased in terms of both having the comprehensive approach that we were looking for, that there were some key goals in areas like cancer screening, and a firm commitment that the cancer screening recommendations would be updated. And I think Antonella set up the figures very well on lung cancer. You know, this is the most common cause of cancer death, and accounts for actually more than 4% of all deaths in the European Union. So any sort of cancer plan that didn't sort of pick up on that and reflect that wouldn't have been given good attention to the stats. But we needed to work with member state governments and others to try to put the case for lung cancer screening to be covered and included within the EU recommendations. And there was some pockets of resistance, but pleased to say that we were able to overcome that. There is so much good data out there now from Nelson trials and elsewhere that in the end, lung cancer screening was included in 2022 in the recommendations. And now the momentum is really continuing, because that was a fear as well, that maybe these recommendations would be left and not enacted. So there's EU funding going in for pan-European projects like Solace, which are helping to develop the European standardized approach to lung cancer screening, sharing good practices, helping support piloting programs. So it's really exciting to see all that happen from where we were 5 years ago. And I'm looking forward to the future next year and the more things that we can do as well. So thank you for bringing us together again, Marius. And it's nice to have this sort of pan-European community of lung cancer screening advocates working together too.
Thank you, Richard. And indeed, it's very good to look back 5 years ago to understand better to understand the current landscape, because we actually had to manage a pandemic, a new reality in Europe, the war in Ukraine, and other challenges, economic challenges, and so on. And look, after 5 years, we are here implementing the European Cancer Plan. Of course, at different speeds in terms of implementation, differences between member states, maybe in terms of priorities and so on. But what you mentioned, and you, Antonella, as well, is the science actually who is feeding this topic of cancer screening in general, but we are discussing today about the lung cancer screening. So thank you so much, Richard, for this policy umbrella you presented in our webinar today. And I'm moving now to the next speaker, Raluca Simbotin. He is Director of Policy and Governmental Relations at MSD, Romania. The MSD is the main partner for our webinar and project, Innovation in Lung Cancer Screening. So Raluca, the floor is yours.
Good morning, and thank you, Marius, for the invitation to attend today's webinar. I would like to start by acknowledging the progress that we have made, not only at European level but also at national level. So yes, at European level, in December 2020, the Council of the EU updated the recommendation include lung cancer. It was also the time when a group of members of the European Parliament launched a call to action entitled "Fighting Lung Cancer Together as Equals." Attention to inequalities our part of the Europe, Eastern Europe, and Western Europe. At that time, there were some topics addressed, including improving prevention, ensuring access to early diagnosis and ensuring rapid access to diagnosis and treatment, and supporting data collection. At national level, I have to mention the efforts made by the Romanian authorities with the implementation of the National Cancer Control Plan. Most recently, we've seen that the SIC found extended access to diagnosis by introducing integrated packages of services that can benefit both, I would say, insured and uninsured persons. But what's the status today and where we are? Despite all this notable progress made in recent years, in Romania, lung cancer remains, I would say, a silent killer. So Romania continues to rank 4th in terms of incidence of lung cancer, which is also the main cause of cancer death. Frequently diagnosed in advanced stages, survival is significantly inferior to other countries, as it was mentioned today. Accordingly to a study conducted by the Institute of Health Economics in Sweden, there are differences between EU member states in terms of diagnosis and access to treatments, in line with ESMO recommendations. So while in Belgium and Portugal, 88% of patients receive treatment for lung cancer, in Romania, only 46% of patients receive treatments, and this is mainly due to delays in the patient journey, and in the absence, of course, of a screening program. It is important to mention that in our National Cancer Control Plan, there are clear objectives related to lung cancer. So it is stated that that the objective is to reduce lung cancer mortality by 5% per year, and to decrease by 25% the proportion of lung cancer diagnosed in late stages, with clear measures. So there are measures in the plan related to early diagnosis, to establishing and publishing the patient pathway, and observing the time indicators, organization of regional networks, establishment of standard indicators of performance of the therapeutic process, implementation of a screening program for, of course, at-risk populations, and the compliance with medical guidelines and protocols. So to conclude, my message is that we need to continue all this effort to build on the foundation of what the previous European Commission did, of all these efforts made at the national level, and continue the progress.
Thank you, Raluca. Indeed, having cancer as the European priority, having in place Europe's Beating Cancer Plan and Cancer Mission was so important at the national level, and was a big driver for the policy development around the National Cancer Control Plan. This is very clear. And the chance, I think, for the patients living here in Romania, or in Bulgaria and Eastern Europe, to actually to benefit from innovations and current care as the patients living in Western Europe, in Northern Europe, and so on. We are so much interested in how to best use different types of innovations in order to reduce the inequality. And coming to this point in our discussion, I actually discovered this year this really innovative initiative coming from Sweden on lung cancer screening, and I'm very happy to introduce Ebba Hallepsö-Hult is the CEO of Vision Zero Cancer from Sweden, from Stockholm. Ebba will be presenting in the next minutes the initiatives around lung cancer screening in Stockholm, as I mentioned. So, Ebba, the floor is yours.
Thank you very much, and good morning. I'm very happy to be here and to have the opportunity to share some of our experiences in building the case for implementing lung cancer screening in Sweden. So let me see if you can see my slide first. Oh, I have to make sure we start from the beginning. Sorry. I don't know what happened here. There we go. So, a few notes on mission-driven lung cancer research and innovation in Sweden. So my name is Ebba Hallepsö-Hult. I have a background in political science and also international business development and policy. I worked many years for the Swedish Trade and Invest Council globally. So I've also had the opportunity to interact with Romania in the past, also working out of Ukraine several years as trade commissioner. And over the years, working more and more also to promote Swedish healthcare and life sciences internationally. And that's how I actually ended up working more closely with different actors in the field of cancer and lung cancer. So I am based at the Stockholm School of Economics, at the Institute for Research, and also at two interdisciplinary houses of innovation and governance and public policy. And from there, we coordinate this initiative, Vision Zero Cancer, that we actually established 5 years ago through a call by the Swedish Innovation Agency to create sort of similar to what we are now developing as Cancer Mission, mission-oriented ecosystems to drive change across sectors and disciplines. We then established Vision Zero Cancer on the initiative of our former national cancer coordinator, who saw the needs for working much closer together to make the right prioritizations, and also to try to accelerate the uptake of innovation. And as he saw that a lot a lot of good developments were taking place in Sweden since the introduction of a national cancer strategy back in 2009, but the research and innovation was lagging a bit behind. And then we saw actually, just like Richard mentioned, the momentum when it came, this came more or less alongside the development of the European Cancer Plan, but we also saw that there was so much to be done in terms of both challenges and opportunities in lung cancer, and that's where we decided to start. So we've set up like two bold missions. One is actually, without really measuring it yet, and I'll come back to that in a moment, to reduce by 50% the number of people dying from lung cancer every year in Sweden, but also in general to work towards a more equal and sustainable cancer care where every patient and citizen is offered accurate and individualized prevention, diagnosis, treatment, and follow-up for the greatest possible quality of life. And of course, under that types of ambitions, every actor can actually sign on to them, and it's easy to be able to convene and to mobilize the stakeholders. So just a few notions on the framework for health system innovation is that we have this funding by the Innovation Agency has enabled us to develop the methodologies and the systems of working together, our governance structure, to work more in a pentahelix collaborative structure where we set these overarching visions and principles on how to work together. And in the center of it, and from where we coordinate at Stockholm School of Economics, we have the so-called more mission orchestration, where we then make sure that we conduct different, it's everything from policy initiatives to creating workshops, to networks, different types of engagement, but also making sure that different actors meet and start different collaborations together. We strive to use a design-driven approach to create impact. We focus a lot on sort of the now and here on the future. So in these groupings, we don't really deal with what is happening on the day-to-day business that we leave for the authorities by themselves, and of course the comprehensive cancer centers, the primary care. We are more like focusing on the challenges around the increase of cases in cancer care. So by 2030, what should we do now, or by 2040, and so forth. And we develop a holistic product portfolio and strive to work across the 5 dimensions of system innovation. And some of this is also, of course, our contribution in our work as we learn from each other in the developments of the cancer mission hubs, where we collaborate very closely with NMED and also the European Cancer Organization and the Patient Coalition in Europe. So I think in all of this, we are in a big community across Europe trying to work together. In our strategy, we decided to align, of course, with Agenda 2030, mainly the overarching goals of good health and well-being, and also industry, innovation, and infrastructure. But we have aligned that with 3 national strategies. So at the core, of course, the cancer strategy, and we're just now having an updated cancer strategy in Sweden, but also the life sciences strategy. Sweden has a very good, thriving life science ecosystem. And of course, we need to attract the right investments to Sweden, also in talent, but also as a highly export-dependent country. And of course, then also our export invest strategy. So that is a little bit of a difference on how we deal with what we're doing within Vision Zero Cancer. We're trying to decide for impact within, of course, the system constraints on national, European, global level, but also making sure that we become attractive in this in a sense of wanting to be a world leader in early detection and treatment and quality of life, but also then bringing different novel solutions to the market. So, of course, a zero cancer, of eliminating cancer as a cause of death, all of you here know that requires a very holistic approach, and we see that it has to be effective across these 2 axes of covering initiatives throughout the sort of patient or health trajectory, from primary prevention across secondary, such as screening programs, the early detection diagnostics, treatment, and quality of life aspects. And where we focus mainly through that axe is then on how do we work with science, with clinical data, health data and registries, organization, leadership questions, and economics and ethics to actually drive the adoption from research and translation to implementation. And that's also what we've been doing in the case of lung cancer. So over the years, we started 5 years ago, we have sort of shaped our initiatives into 5 major flagship initiatives. And the main one, and that actually links to the other initiatives as well, is lung cancer, then the prevention, early detection and screening. Because just as you mentioned, coming back to the numbers that Antonella Cardone mentioned in the beginning, if we can detect early, there is such an important possibilities now for cure or for converting lung cancer to a chronic disease. And that's what we're trying to aim for. Also, in Sweden, lung cancer is the most common cause of cancer-related death among both men and women combined. It has actually surpassed now breast cancer for women in Sweden. We also see a huge increase of the never smokers, both in relative and absolute numbers. So the prognosis for lung cancer has improved, of course, during the last decades due to advanced diagnostics and treatment methods, but still, the 5-year survival rate is only around 24% for men and 31% for women. Every year, 4,000 people are diagnosed in Sweden, and between 2009 and 2018, the number of cases increased with 19%, of which the increase among women were 26%. So as many receive their lung cancer diagnosis late because of the early symptoms can be diffuse and difficult to detect. And we know that more than half of them are diagnosed, have a disease that has already spread to other organs. So we all know, and that's why we're here to discuss, that early detection greatly increases the chances for successful treatment. And it's, of course, the single most important measure for cure. And we also know that it saves a lot of cost as well, comparing to treating in early stage with more curative methods in surgery combined with radiotherapy and some chemo, compared to the arsenal of the whole treatment that we have when it's detected in later stages. We do see, of course, a huge improvements, and with more also now thanks to the new arsenal of new medicines. So the momentum actually for finding early, I think, is bigger than ever. This is just one of my colleagues, Elin, from our initiative, and we were very recently having an exercise saying, what have we been doing this year then in lung cancer, and in terms of activities, outputs, some outcomes and impact, and I will now relate to a few of those. So closing gaps, if you talk about research, it's also about innovating it from the policy perspective. We have been working together with the authorities, with the healthcare professionals, the experts in lung cancer. They have a network across Sweden. They work together in research and clinical, and also in a national care program, and of course with our National Patient Association. Together, we have developed different initiatives, and we have also commissioned a couple of reports to our Institute for Health Economics to assess several years ago now the case for early detection and screening through a health economic assessment. And they based the scenarios and the case on this study synopsis for a national screening program, then developed by the lung cancer professional community group, the Swedish Lung Cancer Study Group, that was in itself based on the result from the Nelson trial, so that we would get the intervals right and adapted to a Swedish context. That was the first case of actually making sure that our authorities would start to really consider implementing lung cancer screening. We thought we would have come much further these 5 years than what we have. I think also the pandemic and other things came in between, but also because there's a fear of the capacity for actually being able to handle all the positive findings and treatments and so on. So a recent initiative that we just published is also the capacity for lung cancer screening in Sweden, challenges and solutions. Also looking into different scenarios with clear cases, just by using AI for secondary readings in different modalities, and how that would actually impact the capacity for radiology exams, and also how that is also showing the case of saving money. So we see that more research and investment into this area is, of course, needed in Sweden as elsewhere, but we have really the cases for that now. Another initiative that we also did was also to finding out more about who would actually come to screening. I think there's been more of opinions, a lot, at least in Sweden, that the majority are smokers or ex-smokers, and it's a lot of still concerns around stigma and fear. Would they actually come to screening? Is it fair to have a targeted screening program? So we conducted a couple of market surveys through the Swedish Opinion Institute, Kantar SIFO, and then also through another agency working with language minorities to actually find out about the attitudes towards a screening program in a population of smokers and ex-smokers. So we had a good representative numbers in the panels, and it was also very nice, I don't know if that's the right word, but also kind of novel or innovative, the way we actually developed the questionnaire to make sure that it would actually be of relevant use for our National Board of Health and Welfare and the Screening Council to use this data. So we were a group together with the chair of the National Screening Committee, representatives from the screening coordinators at the National Board of Health and Welfare and the Association of Local Authorities and Regions, with the comprehensive cancer centers, patients, clinicians, other experts, together with the experts of actually conducting opinion polls to make sure that we could have a good set of questions. And we had very good results from it. This was conducted, I think it's about 3 years ago now. So it has also been used then to design the first implementation studies, how to target the people in different areas and so forth. And what we saw, that what was a bit surprising, and this has actually been proven now after our first pilot study that has been implemented in Stockholm, is that 9 out of 10 persons, both men and women, were positive to the possibility of undergoing a lung cancer screening. And also it showed in details also how one would like to be called through the GP or invitation letters through the traditional channels that they feel more trustworthy for. And also this was independently of different language minorities. We saw that more women than men were positive, and then also depending on the age group. So the older, the more resistant to whether it would be worthwhile for me to undergo screening. The main reasons for doubting to participate would be maybe it's better not to know. You could be a fear of being diagnosed. Others saw it, okay, this could be a good opportunity to know. It can help also then, of course, with smoking cessation, etc. So a lot of information came out of this, and I would be happy to share it with other of you, the details, or see if that could be replicated in other countries. So finding in the local community how to engage and how to involve was very good in that. But then we also looked in addition to looking around screening, we thought also it's very important to look into the early detection in primary care, because we know that the majority are found through primary care or referrals to emergency care, and that so many of the systems, the early systems of lung cancer, could be any cold like the one I'm having now, and just coughing and so on, or fatigue for others, or weight loss. So too many persons spend too much time within the system. It can be years, or it can be at least 15, 20 visits to the primary care without being actually further remitted, and the diagnosis comes late. So we have been part of investing in research with physicians working in primary care, and have also developed new safety netting tools with AI, but also they have actually been given new roles as national coordinators for early detection in primary care, because it's a lot about also developing the awareness and the methodology around early detection. So that are some of the results, and also we've shortened the lead time for decision making for our authorities. And the first trial in Sweden has actually already, out of a panel of 1,000 invited women, and And through the results, 11 women so far have been cured because they were found in so early that they could have totally curative surgery undergoing. And others have been also found in early stages, and it correlates well with the anticipations from all the research behind, and also comparing with other programs. So it's been very, very efficient, better results in the uptake than anticipated. So that trial that started off with the female population in the southern region of Stockholm, that was also because they used the invitation through the call for mammography to get the same age group of 50 to 74, which is a standard age group among smokers. And through questionnaires on smoking habits, they were selected and invited to participate. And throughout the very good results, they are now continuing with men as well in this region of Stockholm. And the north of Sweden and the western part are now starting their implementation studies. And those studies, it's not really about the medical evidence for lung cancer screening, but it's really to solve all the practicalities. It's the referral systems and how to deal with the nodule management, many of the practicalities, and also making sure the capacity with the radiology and so forth. So, and it was actually through those clinicians that the idea came up of looking into the scenarios with AI, also to have like a cost economic case for it, while also looking into the research of the methods. Another important part I just want to mention very quickly is also, of course, to make sure that we develop both networks and sharing knowledge and experience between countries like today, and also we created other Nordic international partnerships. We've also conducted many roundtables and workshops within Sweden, but also then with other countries such as Taiwan and US on when it has to do with never smokers, and a lot of exchange with UK, with NHS through different types of study visits, and also supported to create a good collaboration between their authorities and our screening authorities, so to learn from each other, and then also by that also sort of advancing also the decision making in Sweden when all the practical evidence is in place. And also conducting arenas and debate. I think it's important, just as Raluca and Simbotin mentioned here, this is a silent killer, and it's also a lot of stigma around it, a lot of lack of knowledge. So in different open air democratic and political weeks in Sweden, we have also done, and also at a railway station in Stockholm, if I remember correctly, spirometries and checking your lung health, and also a lot of symposiums and roundtable with the civil society, also to make sure that more people understand what the symptoms, and also to integrate more general lung health thinking from a COPD, asthma, and lung cancer perspective. So that are the types of initiatives that we've been doing to make sure that more people understand that everybody who has lungs can get lung cancer. And yes, so a lot of debates for several years, and we're rather impatient now to see much more moving ahead in terms of a national program. And then also, just for impact and follow-up, just want to mention quickly that to know if we're on the right track and if we're actually making a difference, we do have very good different registries in Sweden, in addition to the cancer registry and death registries and socioeconomic registries and the lung cancer registry. We are now developing an interactive tool where you can actually have the opportunity to address a wide range of important issues to get a better understanding of cancer, also for quality assurance and improvement of cancer care, but to understand where are the different gaps depending on sex, age, level of education, and cancer stage for when being diagnosed, so that we can see are we progressing then in, for instance, in lung cancer by 2030, as we said, and also where are the different big gaps across the country as we're striving to harmonize an equitable access to good quality cancer care. So these are also ways, tools to improve the knowledge, but also then to see, okay, what targeted initiatives do we need to work with, and where should they be done, also to improve the uptake of screening, etc. And we are already seeing now in our data. This tool will be launched by the World Cancer Day in Sweden in 2025 in February. But we are already seeing how in the statistics that Stockholm now is in the lead of detecting in stage 1 and 2 of lung cancer, thanks to the results from the screening. So what gets measured, what gets done is what I wanted to say with this initiative, then with this tool. And if this works out well, and I think then it could be also a tool that can be adopted in other countries, but it's also in our case to see, depending on the region, the incidence and age standardized incidence, etc. And just the last to say again, I think partnering is so important. So the work through the European Cancer Organization and also with the Lung Cancer Policy Network, where we work a lot both in Europe but globally, so that we can together have facilitate cooperation and engage and actually drive this change forward. And I think in this capacity, we also worked a lot with the Screening Council recommendations, and also the SOLAS is part of this, and NECO and others. So there's a wealth of resources there now to use for planning for screening programs, and also for the management of lung cancer, and with interactive maps of all the initiatives ongoing around the world, for instance. So with that, I would like to thank you for your attention, and over to you, Marius.
Thank you very much, Eva, for your presentation, for your initiative in Stockholm. It's great actually to be able to speak about real impact. You already mentioned 11 lives saved by inviting 1,000 women, right, for lung cancer screening. This is really, really great. And another conclusion is that indeed it's really complex to implement lung cancer screening. There's so many nodes, so many details. It's a big network, a multi-layer network actually on this, and we'll try to dissect some of the, I think, key points from your presentation. And I will start with you, Antonella, because it was clear that this program is really citizen and patient-centric. And I personally enjoy how actually you, Eba, you use social sciences to understand preferences of the smokers, of the people, of the citizen on one side, and how you build beyond let's say, very concrete activities on lung cancer screening. You build awareness campaigns, going in the community, in the societal level, and to increase the awareness on the lung health. And what is your perspective on Antonella on this?
Well, I agree with you, Marius. Eba presented a very, I could say, best practice on implementation, the practical implementation of lung cancer screening in a country. And so when we look at the successes in Sweden with Vision Zero Cancer leading the way, there are several key lessons that we can identify. But I would like to narrow a bit and stay very focused. And I would say that first, there is the need for a strong political commitment and dedicated funding. So this is essential. Then Sweden has prioritized lung cancer screening as a public health issue, and this has translated into concrete action. They developed synergies with several relevant strategies within the country and also outside the country. So this is very important. And combining efforts around a common goal is crucial, not to waste resources and stay focused. Then the second point to me is that well-defined eligibility criteria and efficient referral pathways are crucial. So ensuring that the right people are screened at the right time maximizes the benefits and minimizes unnecessary procedures. Ebba mentioned the case of those 11 women that were cured 100% as the tumor was identified at a very early stage. And then the third point is that highly quality early detection. So accurate interpretation of scans is vital for early detection and appropriate follow-up. And Ebba also mentioned the intention of using more and more artificial intelligence to make sure that the early detection is more and more effective and efficient. And I stop here for now.
Thank you, Antonella. Indeed, political support, financing, and I will add the governance. And I'm looking to you, Richard, maybe to comment on this. You presented and I really like that, the pentahelix model and the mission orchestrator, and I think this is or not, I don't know. I'm looking to you, Richard, to answer to this, because this topic is really complex and require actually the inclusion of all relevant stakeholders. But somehow we should be able to manage this landscape.
Sorry, you can hear me okay?
Yeah.
Yes.
Yeah.
Well, I think, one of the things with lung cancer screening being comparatively novel compared to maybe some other forms of screening, there's a vast sort of lesson learning taking place between countries, and that's why it's so good that we have this framework of EU cooperation, because the lessons are being transferred. And so it'll be interesting to see how that develops in terms of governance of screening, but we also see lots of different approaches about how you reach hard to reach groups, for example, the use of mobile screening. I thought there was lots of interesting slides there from Eva as well about regional differences, for example. In a country like Sweden, I can imagine you've got issues of urban rural access that has to be combated, which whatever's learned from Sweden can be transferred to Greece or wherever. So I think as well the website that Eva shared of the Lung Cancer Policy Network, that gives you a great picture of what's happening across Europe. Anyone on the call who wants to learn a bit more about what's going on, a bit of time spent there is well worth it. We've also sort of made a recent contribution as well in terms of the overall picture on screening, not just lung cancer screening, but prostate, breast, and others. We published very recently a screening policy index, and that shows, according to some publications from the Solace project, where each country currently is. And so what's quite interesting about that is, I think if you asked people on the street which countries in Europe are leading the way in embracing new technologies in lung cancer screening, they might say Germany, France, etc. That's not the answer. It's countries like Czechia, Poland, Croatia. They're really sort of embracing this and showing the rest of Europe what to do. And I think that's a great example. If we think as well about some of the challenges that our new European Commission has, how do you make an innovation-friendly Europe? Well, this is a good model of sort of seeing the technology early, bringing people together to work together in adopting it, and rapid sharing of lessons. So I hope maybe this can be a bit of a case study for the next new commission to learn from and think about the other innovations that are coming forward in cancer and how to respond to that. What's also interesting as well is you see that this has become an area of global interest, where Europe is becoming something of a leader in some respects. You see the US has established a lung cancer task force with the EU, and it might be a sort of an occasion where maybe even America is going to draw some lessons from Europe on this topic. And who knows? And I think with UK as well, being very invested in the field of lung cancer screening, we still remain hopeful that perhaps they might connect through the EU for Health programme to be involved in future initiatives. So yeah, it's a great case study of countries learning together.
Thank you, Richard. Indeed, a great case study. And I would like to ask you, Raluca, you are coming from on one side from the industry, on the other side from Romania. So, what can be, I don't know, actionable from what Eba just presented, and what can be actually done here locally?
I would like to start by building on what I mentioned regarding to the remarkable progress when it comes to technology. So she mentioned emerging technologies such as AI, which can be, of course, used in order to enhance the accuracy of low-dose CT. I believe that in this field, in IT particularly, in Romania, we do have a highly skilled workforce, which can support, which can build digital health tools, which can play a transformative role in patient tracking. Of course, there is also progress when it comes to the development of therapies. I can mention targeted therapies, immunotherapies, but here I have to highlight the fact that the success of these treatments depends on early detection of lung cancer, and we will go back to the discussion around screening. What can Romania do better? From my point of view, I believe that we need to continue the implementation of the National Cancer Control Plan. We need to start discussing about a screening program, because we do have I would say the resources needed. And here I would like to mention the fact that we have an operation program for health with a dedicated budget for establishing a screening program in Romania. In addition, I believe that there are some small adjustments in the systems which can improve the patient journey. And here I need to mention the fact that Romania should establish and approve a patient journey to guide the movement and referral of lung cancer patients between primary, secondary, and tertiary care. There is also a need to support training, of course, and availability of specialized and dedicated nurses or patient navigator to guide lung cancer patients through the systems. And of course, we should also improve access to modern and effective lung cancer medicines with focus on early stages, which in Romania, I believe that it's a challenge. It takes up to 2 years to new innovative treatments. Last, I believe that Romania should act with commitment and ambitions on country-specific assessments on disparities, and of course addresses. We should also not forget the patients which already receive a diagnosis and are on treatment. And here I see some struggles. It's important to ensure the continuum of care, of course, and to allocate additional resources.
Thank you, Raluca. Eba, do you have a comment?
Yes, thank you. First of all, thank you very much for everybody on your comments on what I just presented. And just wanted to highlight also that what we have, when I say we, of course, our researchers and clinicians and authorities, what they have built into also this planning for the implementation studies, and also the one conducted in Stockholm has actually been researched. So they make sure from the beginning to get the right samples, but also looking into new biomarker research that they're already working a lot with at Umeå University Hospital, for instance, so that we can also bring in this new, it can be new technologies, but also new evidence. So it's not just about the practicalities of implementing, which is a big part that they also follow through, but also looking into the new possibilities. Sweden adopted years ago standardized care pathways from suspicion to confirmation of diagnosis built on the Danish model. And of course, also for lung cancer, and for many years, we've had a national program through the working group that sort of brings together the experts across the country. And the care programs are then with the guidelines updated annually, or there's a special process for it. But of course, also make sure now, and also within these care working programs, that we also have primary care involved, and also patient representatives part of designing the program. So I think that's our part that we could perhaps also collaborate with Romania, and make sure we can have a follow-up discussion where with the relevant clinicians and other experts can participate and dig deeper into some of these aspects in this field of learning. And I think one of the reasons why we haven't come further these 5 years is also that our authorities knows that it's a huge and complex machinery to launch a national screening program. And we have a decentralized healthcare system, and in the end, it can be a national recommendation and some stimulation and seed funding for national, but it's up to the regions to implement. It took us 10 years to implement fully colorectal cancer screening. And based on that sort of bad experience in many ways, they have been very hesitant to see, do we have the capacity? So even though we have skilled workforce, we see a lot of shortage of pathologists and radiologists, and many have said, can we actually deal and cope with this massive additions with lung cancer? But then we see, in the end, it might be not that many cases, so it can be very smart to have these targeted programs as well. So by doing this study, so it's also our national board wants Sweden to conduct many studies to make sure that we cover all the bits and pieces, of course, and this endeavor. Just wanted to highlight.
Yes. Thank you, Eva, for highlighting this research and innovation part of your initiative. This is really crucial and is different than the other, let's say, traditional cancer screening programs, very well known for many years, with not so much, let's say, research and innovation. In lung cancer, I think we have the opportunity actually to build this model, and it's so helpful to use research and innovation, different kind of tools, and especially this framework of the missions in general to deal with this topic, and of course the new technologies. On the other side, yes, it's our intention to continue this exchange next year. So and we are very, very much interested to go into more details on the topics you presented. We have 3 more minutes in our webinar, and I have one final question for you all. And this is based on one of your slides. You presented the impact pathway for lung cancer screening, with activities, with outputs, outcomes, and impact. And coming back to your initial point, Richard, going 5 years ago, and where are we now? And for the last part of the webinar, the question is, so using this framework activities, we are doing now some activities, we expect some outputs, some outcomes, but what the impact would be for a lung cancer screening program, I don't know, in your country, in your community of patients, at European level, you name it. So how do you imagine this impact in 5 years of the impact of current activities? And I'll start with you, Richard, of course.
Well, I think lung cancer screening is very interesting because it's a bit different from other types of cancer screening, because it's also associated with things like smoking cessation. It's also associated to, there's lots of public health information and literacy opportunities provided by it. It's also got an impact for other lung conditions as well beyond cancer, because things like tuberculosis or other lung conditions can be picked up. So the impact is really quite wide and sort of requires a slightly different approach and understanding the value of that perhaps also needs to be caught up with. So that's what also makes it very attractive.
Thank you. Antonella.
Well, very briefly, now at the European level, we have the right framework, the right policy framework, I could say, with the EU Council recommendations on screening, Europe's beating cancer plan, cancer mission. So on the side, we are covered, but still a lot needs to be done in terms of putting this policy framework into action. And one challenge that is on our radar is about inequalities. So as a cancer patient association at the European level, we are also looking into avoiding the increase of inequalities in terms of access to screening, then early diagnosis, and then consequent early treatment.
Thank you, Raluca.
Marius, I believe that in Romania we have the legislation needed, as I mentioned, with the National Cancer Control Plan. We have clear targets when it comes to lung cancer. So now it's just a matter of implementation. And as it was the case when the National Cancer Control was developed, I believe that when it comes to the implementation stage, it's also important to have a joint effort between authorities, between doctors, between patient organization, and I would say the pharmaceutical industry.
Thank you. And Ebba.
Okay, so I think, well, then of course I'll come back and represent my Swedish perspective here in terms of impact. So I hope that in these next coming 5 years that we will have a fully rolled out screening programs, targeted screening programs for the risk group of smokers and ex-smokers. And according to our statistics, at least then we would find 163 people with lung cancer who would undergo curative treatment, and we would potentially at least save 143 lives per year. So I think that is the impact I want to see in the next 5 years. 143 lives saved annually. Just to at least give you the numbers of Sweden, we're a population of about 10 million, where this smoking incidence today average is about 5-6%, which is often used as why do we need a screening program? But we have a lot of ex-smokers, and in some areas it's up to 20 to 35% of smokers still. So yes, we need this. Sweden is a rich country, we can afford this, and we need to have it implemented for those who need it. Combined, of course, with other initiatives. Also, if we have other with an average smoker, 200 lives at least per year. I would like to see that. And live with better quality.
Great. So Ebba, Antonella, Raluca, Richard, thank you so much for joining the Innomed webinar this morning. As I mentioned, we will continue with this topic next year, and in order to catalyze more local initiatives around the lung cancer screening here in Romania, and of course using innovation in all aspects, technological, pharmaceutical, societal innovation, policy innovations, to drive this movement forward. Thank you so much to you all and to our viewers, and have a good day.